discuss about the urinary catheterization. This is our repeat class. Okay. Catheterization of the urinary bladder is the insertion of a hollow tube through the urethra into the bladder for removing urine. It is an aseptic procedure for which sterile equipment is required. Purpose of the urinary catheterization and indications are to relieve urinary retention, obtain a sterile urine specimen, measure the urine output, empty the bladder before, during, or after the procedure, and allow accurate measurement of urine output. These are the indications in which we can pass the catheter, urinary catheter. Okay, urinary catheter sizes. The French scale is used to denote the size of catheter. Catheter are denoted by the French is a unit of the catheter. Each unit is roughly equivalent to 0.33 millimeter in diameter. That is 18 French. Indicate a diameter of 6 millimeter. The smaller number of catheter, a large size catheter is used for the male because it is a stiffer the urethra or the penis, thus easier to push the distance of the male urethra. Okay, catheter come in the various sizes. Number 8 French or a number 10 French are usually used for the children, and number 14 French and 16 French are used for the females adult, and number 20 and 22 French are usually used for the male adults. Types of urinary catheter: intermittent catheter. An intermittent catheter is used to drain the bladder for short periods, 5 to 10 minutes. If you have to take a urine specimen for the culture, so you can use this type of catheter. Retention or indwelling catheter. This type of catheter is placed into the bladder and secured there for a period of time. If a patient going to the surgery, if a patient is acute retention, history of the acute retention, so you can use the indwelling catheter. And suprapubic catheter. This type of catheter is inserted into the bladder through a small incision above the pubic area. It is used for the continuous drainage. If you pass to fail the urinary catheter through the penis, through the urethra, so you can do it for the suprapubic catheter. That is a small incision above the pubic area, and then you will insert the catheter through this incision. Preparing for catheterization. A catheter should be used only when absolutely necessary, and the catheterization procedure itself should be done only by trained personnel under sterile condition. Infection is a major risk of urinary catheterization. Okay, when you pass the catheter, when you pass the urinary catheterization, you have to gather the equipment, and which equipment you will need. That is the catheter. If a patient is a child, so you can use the catheter size number 8 to 10, and the patient is a female adult, so you can use the catheter size 14 to 16 French catheter. And if a patient is a male adult, so you can use the catheter size 20 to 22 French. And the 10 cc syringe for what? 10 cc syringe for the check the balloon patency of the catheter. Okay? And I will tell you about the 10 cc syringe. Sterile water. Sterile water. What will we need for the sterile water? When you check the potency of the balloon, you fill the balloon with sterile water, not the normal line, not the glucose water, just for the sterile water. If you fill the balloon with normal line, there is the formation of the crystallization. That's why we have to use sterile water. Cotton balls with betadine. Betadine is the povidine. Povidine is the pyridine. Lubricant. Which lubricant we can use is xylocaine jelly, sterile gloves, surgical sterile gloves, flashlight or a lamp, urine collection bag, and Velcro leg strap or anchoring tape, which is adhesive tape, disposable bags. Now, identify the patient, introduce yourself, and explain the procedure, and provide the privacy. If a patient is female, so make sure the privacy, maintain the privacy and adequate lighting and the positioning. If a patient is female, so if a patient is a female, the position of the female position in a dorsal recumbent position, in which knee flex and feet about 2 feet apart. Okay, female position is a dorsal recumbent position and with knee flex and 2 feet apart. Cover the upper body and each leg. Place catheter set between the female patient legs. And the male patient position is a supine position. Drap the patient so that only the area around the penis is exposed. Place the catheter set next to the leg of the male patient. Female patient position is dorsal recumbent position with knee flex, and male patient position is a supine position, and the supine position, and the penis going to upward and the parallel position. Okay. Now inserting the Foley's catheter in a male patient. First of all, cleanse the genital area and perineal areas with the warm soap and water, and rinse and dry. Wash your hand carefully. Open the sterile catheterization kit using sterile technique. मैं आपको बार बार बता रही हूँ कि using sterile technique, this is a invasive procedure. There is a high risk chances of the contamination or infection. That's why using a sterile technique. Put on the sterile gloves, open the sterile drapes and place on the patient's thigh. Place the fenestrated drape with opening on the penis. Apply sterile lubricant to the catheter tip. Lubricate at least 6 inches of the catheter. Leave the lubricant catheter on the sterile field. You cannot leave the lubricate catheter outside the sterile field. Remember that. Pour the antiseptic solution over the cotton balls. Place the urine specimen collection container within easy reach. Okay, grasp the patient penis between your thumb and forefinger of your non-dominant hand. क्या करना है? Grasp the patient penis between your thumb and forefinger with your non-dominant hand and retract the foreskin of an uncircumcised male. Okay, the glove hand that has touched the patient is now contaminated. Grasp the patient penis with your non-dominant hand, and glove hand that has been touched the patient is now contaminated. Use the forceps to hold the cotton balls. Will maintain the sterility of one hand. Non-dominant hand is now contaminated, and the other hand which you hold the cotton balls, that is a sterile hand. Using the forceps, pick one the cotton ball and swab the center of the meatus outward in a circular manner. Okay, now clean the surface area in a circular motion, inward to outward. Continue outward using a new cotton ball for each progressively large circle. Clean the entire gland. Deposit each cotton ball in the disposable bag. After the last cotton ball is used, drop the forceps into the disposable bag as well. Okay. Now hold the penis at 90-degree angle. Advance the catheter into the patient urinary meatus. You may encounter resistance as the prostatic sphincter. Hold the penis at the 90-degree angle, which shown in the picture. Pause and allow the sphincter to relax. Okay. Lower the penis and continue to advance the catheter. Never force the catheter to advance. Discontinue the procedure if the catheter will not advance or a patient has unusual discomfort. So you can immediately क्या करना है? You can immediately out the catheter. When the catheter has passed through the prostatic sphincter into the bladder, urine will start to flow. Gently insert until 1 to 2 inches beyond where urine is noted. Is it clear? And now inflate the balloon using correct amount of sterile water, which I told you we have to use sterile water or 10 cc. 10 cc, but check actual balloon sada. Why we use to 10 cc sterile water? The size of the balloon catheter is 10 cc. That's why we have to use 10 cc sterile water. And then gently pull the catheter if the catheter has been passed and balloon will be inflated, or then you can pull the catheter until the inflammation balloon is snug against the neck. You can pull back the catheter. You feel the resistance. If you feel the resistance, then it's mean catheter fixed around the bladder neck. Connect the catheter to drainage system or the drainage bag. Now the catheter tube to the lateral abdomen with tap without tension or the tubing. Place the drainage bag below the level of the bladder. Evaluate the catheter function and the amount, color, odor, and the quality of the urine. Remove the gloves, dispose the equipments, and wash your hands. At the end of the procedure, document size of the catheter inserted, amount of water in the balloon, patient respond to the procedure, and assessment of the urine. All of these things document on the file. Okay. What was the male patient position? Male patient position is a supine position. And which size of catheter we can use in the male patient? If we have to use the male patient catheter size of male patient 20 to 22 French. And what was the procedure? Firstly, introduce yourself, wash your hand, and take a consent, and wear the gloves, and maintain the sterility, and gather all the equipment, and check the balloon patency with the syringe, and all of these things. in the male patient procedure. Now we can move towards the female patient. Follow the same procedure. Gather the equipment, and female patient position is a recumbent position with knee flexed, and drap the sheet under the buttocks, and apply the fenestrated sheet, and clean the surface area with pyridine or pyridine antiseptic solution, and place the thumb and forefinger of your non-dominant hand between the labia minora or a labia majora, spread and separate upward. Open the expose the surface area with your non-dominant hand, and the glove hand that has touched the patient is now contaminated. Non-dominant hand is now is contaminated. Using the forceps, pick up the cotton ball saturated with antiseptic solution. Use 1 cotton ball for each stroke. So swipe from the above the meatus downward toward the rectum. That is clear? Downward toward the rectum. You have to clean the surface area towards the rectum. Keeping the labia separate, cleanse each side of the meatus in the same downward manner. Don't go back over any previously cleansed area. If you clean the surface area, don't go back. Deposit each cotton ball into the disposable bag. After the last cotton ball is used, deposit the forceps into the bag as well. Okay, continue to the hold labium apart after cleansing. Insert the lubricate catheter into the female patient via urinary meatus. Angle the catheter upward as it is advanced. If the catheter will not advance, instruct the patient to inhale or exhale slowly. This may relax the sphincter muscles. Okay, that is the key point. You can remember that if the catheter will not advance, instruct the patient to inhale or exhale slowly. This may relax the sphincter muscles. Don't apply the force on the catheter. When urine starts to flow, insert the catheter approximately 1 inch further. Place the cup under the stream of falling urine to obtain a sterile specimen if required. Now inflate the balloon using correct amount of sterile water, which I told you that the 10 cc of sterile water we can use, and gently pull and back the catheter until inflammation is snug, and connect the gently pull the catheter until the inflammation balloon is snug against the bladder neck. And at the end, connect the catheter to the drainage system or the drainage bag. Okay. Connect the drainage bag to the catheter. Secure the catheter to the inner accept of the female patient thigh. Place drainage bag below the level of the bladder and evaluate the catheter function and amount, color, odor, and quality of the urine. You can also check all of these things, and at the end, remove the glove, dispose the equipment, and wash your hand. At the end of the procedure, document size of the catheter which you inserted, amount of the water in balloon, patient response to the procedure, and the assessment of the urine. Okay. And now maintaining an indwelling catheter. How to maintain? Wash your hand before and after caring for the patient and wear gloves when handling an indwelling catheter. Clean the perineal area with soap and water twice daily. And after each bowel movement, especially around the meatus, use a separate area of the cloth for each straw. Avoid uses of the lotion or a powder in the perineal area. Arrange for the patient to take a shower or a tub bath when permitted. The collecting container may be hang over the side of the tub. The catheter should be clamped temporarily if the collecting container is higher than the bladder. Teach the patient to maintain the catheter. Self-care helps the patient to develop a feeling of independence and promote cleanliness. If the patient is ambulatory, instruct him in his use of the leg bag. Encourage the patient to intake 2500 cc to 3000 cc of fluid daily. Change the indwelling catheter as necessary or in accordance with the local policy. Removing an indwelling catheter. Assemble all supplies and equipments. First thing is tendency syringe, washing cloths and towels, examine gloves, soap and water. And identify the patient, explain the procedure, advise him that there will be a slight burning during removal of the catheter. Provide privacy and assist the female patient into a dorsal recumbent position, and male should be in a supine position. Which position in a male patient? Dorsal recumbent position, and male should be in a supine position. Wash your hands, put on the gloves, empty the balloon by inserting the barrel of the syringe and withdrawing the amount of fluid used during inflation. Pinch off and gently pull on the catheter near the point where it exits from the meatus. Clean the perineum or penis with soap and water. Dry the area well. Inspect the catheter to be sure no remnants remain in the bladder. If the catheter is not totally intact, report this promptly and save the catheter for further inspection. Empty the drainage bag. Measure the amount of the urine and record it on the intake and output I&O sheet. Remove the gloves and wash your hand. Discard the disposable supplies and return reusable supplies and equipment to the appropriate area. Now record that the catheter was removed, the time and date by the worm. Note the amount, color and clarity of the urine in the drainage bag. Also document all patient teaching done and the patient level of the understanding. After removal of the catheter, assist the patient for 24 hours for pattern of the urinary elimination. Okay. Note the time and the amount of the first voided urine. And report inability to void within 8 to 10 hours. Frequency, burning, dribbling or hesitation in starting the stream of the urine. Cloudness or any other unusual color of characteristics of the urine you can report. Provide a level of the fluid similar to the intake when the catheter was in place. Record that the catheter was removed, date and time by the worm. Okay. Now I will play the video.
Good afternoon, everyone. My name is Keith Rourke. I'm a urologist here at the University of Alberta, and today I thought we would go through urinary catheterization. Essentially, today what we'll be doing is learning what a catheter is, why people need urinary catheters, go through a little bit of what the urethra is, and also run through some of the proper catheterization technique, review some types of catheters, and at the very end of it, help you troubleshoot difficult catheterization scenarios. So what is a urinary catheter, you may ask yourself? Quite simply, a urinary catheter is either a latex, polyethylene, or silicone tube that one places inside the urinary tract to drain urine from the bladder. Generally speaking, it's made up of a couple of parts. It's a tube. Most of them have two ports. One is a tube that you use to drain urine through. The second usually has a colorful cap on it, and it's through that you inject fluid that will keep the catheter in place. So, just to demonstrate, if I inject a syringe with fluid or air into this catheter and you inflate it, you will start to notice that this balloon inflates. And as that balloon fills to usually about 10 cc's as a standard, this balloon is what holds the catheter in place while it's in someone's bladder. So that's the basic anatomy of a catheter. The other thing you'll notice is that caps do come in different colors, which indicates the different sizes of the catheters. How we measure the size of the catheter is in a unit called French. And French is simply put the circumference. So a 16 French catheter, which is what this is, purely indicates that the catheter is 16 millimeters around in circumference. And so these caps are different colors to indicate what size the catheter is. They go all the way up to 24 French, which is a light blue cap, usually all the way down in adults to 14 French, which is a green cap, or even 12 French, which is a white cap. So quite honestly, you can look at a catheter that someone has in and know exactly what size it is by simply looking at the cap. So the basic catheter anatomy is there's two ports, one for draining urine, another one for inflating a balloon, and you can always tell the size of the catheter by the color of the cap, which will tell you the circumference around, measured in French. Putting a catheter in, I think, is an essential skill in medicine. Why does someone need a catheter? Well, there's a couple of reasons, and one of the most common reasons is someone can't urinate at all, and we call that acute urinary retention. So in these instances, the patient's very uncomfortable, the bladder is full, and we place a catheter in order to empty the bladder efficiently. The other reason we put a catheter in is for people to have monitoring of their urine output. And that is usually closely associated with the degree of perfusion in their body. So measuring urine output can give you a very good idea of the status of someone's hydration and their overall volume status. The third reason that mostly we urologists put catheters in is for the purpose of evacuating clots and blood from the lower urinary tract. There are some cases where you wouldn't want to put a catheter in someone's urethra, and that would be the unique circumstance where someone sustained a pelvic fracture and has injured their urethra. In those cases, you want to do a urethrogram and assess the status of the urethra before putting a urinary catheter. In basic terms, the urethra has four parts, and these are divided into the anterior urethra and the posterior urethra. The anterior urethra starts at the tip of the penis, and that's called the penile urethra, obviously, then extends into the bulbar urethra, which extends behind the scrotum, and the anterior urethra ends where the membranous urethra and prostate form. So the posterior urethra is the other part, and that's both the membranous, also known as the external urinary sphincter, and the prostate. And those two together combine the posterior urethra. So when it's time to put a catheter in, always ask yourself if a catheter is needed. Well, once you've determined that a patient needs a catheter, you'll need some equipment. So come on over here. In terms of catheterization equipment, you'll need a set of sterile gloves. In this case, it's not completely sterile. You'll also need a sterile drape set. So most catheterization kits will come with a sterile drape, usually in two parts. Once you have your sterile drape, you'll also need your cleaning solution. In this case, it's a betadine solution. You'll also need lubrication, usually some form of jelly lubricant or other various forms. You will also, of course, need your catheter, and they come in various forms, and we'll review each of those near the end of the video. You'll need a syringe to inflate the balloon with water, and you'll also need, at the very end, a collection bag. And this collection bag is essentially a tube that will hook up to the drainage port of your catheter that will collect the urine. This catheter bag then usually has measurements on the side. In this case, it's not very accurate gradients, but will tell you in general terms how much urine the patient is making. And then, of course, at the very end, there's a little lever for releasing that and emptying it. So that's your basic equipment. In this instance, we have a patient here in dire need of a urinary catheter. So our first order of business after preparing the sterile field is to prep the patient and then prepare for the sterilization part of the procedure. We have a catheter drape, which in this case we'll put over the patient's genitals. And at the very same time, we'll put another one up at the very bottom to kind of create our sterile field. Once you've established your sterile field, you can do this either before or after, is we'll obtain our swabs. And what we will do is then, with one hand, which is now a little bit contaminated, take the swab with the other, and we'll dab it around the urethral opening and the rest of the penis. Now, you don't have to sterilize the whole area, but obviously the part that you will be placing the catheter through. Once you've done this, usually 2 or 3 times, you can place your swabs to the side, and then you can simply grab your catheter, make sure it's well lubricated with all the lubrication that you can get, and then you can start the process of placing the catheter. Obviously, the whole time you're reassuring the patient that everything's going to be okay. When you grab the male penis and urethra, it's very important that the penis is pulled straight up and on stretch, because the urethra has a curve to it. And if you just leave the penis hanging and try and put the catheter in this way, it will be very difficult. So one of the key points is to put it on stretch, pull up to the ceiling as far as you can without hurting the patient. And then subsequently, with your well-lubricated catheter and a steady pressure, introduce it into the urethral meatus. And then the key thing is not to grab halfway down the catheter. You want to very firmly, with very short sections, advance the catheter into the urethra, very gently. So about 1 centimeter or 2 at a time, steady pressure. If you grab too far back, it's going to buckle, and you won't be able to get the catheter in. So a firm but steady pressure, 1 to 2 centimeters at a time, passing the catheter in through the urethral meatus with the penis on stretch throughout. Once the catheter is in, all the way up to the hub, you can then subsequently take your syringe, insert it into this port, and you can subsequently inflate the balloon with a total of 10 cc's. So in this case, we'll inflate the balloon partly. Then what you can do is sometimes push gently on the bladder to make sure you get urine back. Now, some people will, in fact, prior to inflating the balloon, push on the bladder, make sure there is urine. But then once you know you're in the bladder and the balloon is inflated, you pull the catheter back, you'll feel the balloon pull, and then you'll be able to drain the bladder of urine. When it's time to take your catheter out, you can simply place your syringe, deflate the balloon, and remove the catheter. There are different types of catheters that we have available. In this case, the catheter that we inserted is commonly called a two-way catheter or Foley catheter. This one, just to review, has a drainage port that, again, you'll hook your catheter bag up to, and the other port, the second port, is to inflate the catheter balloon. Now, in some instances, you can encounter difficulties placing this catheter because of the angle of the urethra at the junction of the anterior and posterior urethra. So there is something called a coude tip catheter. And a coude tip catheter, simply put, is identical to a regular Foley catheter, except for one key difference. And that key difference is a curve. So in this instance, in some men with really big prostates, you can't put a regular catheter in. So you'll use a coude tip catheter with the curve pointed upward and place it down the urethra with the tip pointing up. And that will help guide the catheter up and into the bladder in some difficult catheter scenarios. Another type of catheter that we have is called a three-way Foley catheter or three-way urethral catheter. In these instances, it's very similar. You have a balloon port, and in this case, this is purple, tells you that it's 22 French. You have a drainage port where the urine will drain from, but the key difference is this third port. And this third port allows fluid to flow in to the bladder. So you have a series of ports, one for inflow and others for the outflow. So this is the kind of catheter that we put into the bladder to irrigate blood clots out and then to irrigate saline or other fluids into the bladder to prevent those clots from reforming. So these catheters, as you might expect, are a little bit bigger than the regular catheter. So in this case, this is a 14 French. In this case, it's a 16 French coude. In this case, it's a 22 French, but three-way Foley catheter. So these are very similar to any other catheter except for the third drainage port, and they're slightly bigger in size. So if you can put a regular catheter in, you can also put a coude catheter in. You can also put a three-way catheter in. Now, the coude tip catheter is very useful, as I said, for men with prostate enlargement, where you have some difficulties placing the catheter because of the size of the prostate. There are other situations where you may have difficulties placing a catheter, and one of those is somebody has a very narrow foreskin, and the problem is you can't retract the foreskin in order to get the catheter in. Another common scenario might be someone's urethral opening or the urethral meatus is quite narrow, and in those cases you may need the assistance of a urologist to dilate that area open. Another reason similarly would be a urethral stricture, which is a blockage in the urethra, or something else called a false passage. And simply put, in some of their instances, the penis may be buried or may be very swollen, and you may have difficulties placing a catheter in. Some of the catheter scenarios that we commonly encounter in a ward situation is what we affectionately call the self-TURP. And that is where a patient will subsequently remove a catheter forcibly, and that will cause some trauma and some bleeding. In those instances, you can safely place another urinary catheter. So as you can imagine, there is a bit of trauma sustained during that, because if you inflate the catheter balloon to its normal size, and in this case, a 3-way Foley catheter holds about 30 cc's in the balloon, as I'm demonstrating here. So that balloon, when a poor old fella steps on it and pulls it out, it can cause a little bit of urethral trauma. So in these instances, there's a lot of blood through the urethra, but in most cases, you can try to put another catheter in. It'll drain the urine and tamponade any of the bleeding. Another issue that we'll encounter is people will have difficulties placing a catheter after a fairly long distance. So the catheter will go.
Okay, two-way balloon catheter inflated sizes is 10 cc syringe. We can use the 10 cc syringe of sterile water, and the three-way catheter balloon size is 30 cc syringe. 30 cc sterile water. Through the 30 cc sterile water, inflate the balloon.
About halfway down the urethra. In those instances, you should probably suspect a urethral stricture. And then what you could try is smaller catheters. If you're using a 16, maybe try a 14, or even go down to a 12 or 10 French. You might be able to negotiate through that area of narrowing. So if somebody you suspect has prostate enlargement, you can try a coude tip catheter to negotiate through the prostate with the tip pointed up. And in some cases, it may be very helpful to use a larger catheter, because a big prostate may require a little bit more pressure to negotiate the catheter through those large lobes. If the catheter doesn't go very far in before you hit a blockage, you may want to use a very small catheter, like a 14 French. In other cases, if there's a bit of bleeding from the catheter being removed forcibly, placing another catheter is usually no big deal. So in summary, a urinary catheter is an important part of a doctor's job, at least I think, and I think it's an important skill for every healthcare professional. We use catheters for things like urinary retention, which help patients tremendously. We also use catheters to monitor the volume status of sick patients. Keep in mind that catheters, for the most part, are very easy to place.
Indications of the urinary catheterization are urinary retention, monitoring the volume status during the procedure, after the procedure, or before the surgery, after and during the surgery, or taking a specimen.
Keep in mind the urethral anatomy. Also, now you're aware of the 3 different types of catheters: the regular, 2-way Foley catheter,
regular catheter, which is indwelling catheter, that is indwelling catheter, and normally we will use in female patient, and 14 to 16 French catheter, which is indwelling 2-way catheter, and for the male patient we can use the 20 to 22 French size of catheter, and that is the 2-way catheter, and the 3-way catheter used for the irrigation.
the coude tip catheter, and the 3-way catheter. And keep in mind some of the common difficult catheter scenarios that we reviewed. And whenever there's a doubt, do not hesitate to call a urologist. It's our job.
Now I'm paying the female catheterization.
Hi, I'm Barbara Pettit, and today I'm going to talk to you about how to place a urinary bladder catheter. This video will cover the indications, contraindications, supplies you'll need to place the catheter, how to prepare the patient, how to place the catheter while maintaining sterile technique, securing the catheter, as well as some troubleshooting and complications that can arise. You should already be aware of the relevant anatomy and have a basic understanding of the indications and contraindications. Speaking of which, indications for indwelling catheters include the need to precisely monitor urinary output, relief of urinary retention, a neurogenic bladder, patients who are immobilized or incontinent, including patients that are not conscious, and intraoperative patients, and after urethral surgery. Non-indwelling or straight catheters can be used for retrograde bladder irrigation, obtaining sterile urine samples, such as in children who are too young to produce a clean catch sample, or to administer contrast for certain radiologic studies. Of course, there are other indications, but these are many of the most common reasons. Contraindications for placement of a urinary catheter include a history of urethral stricture, a urethral trauma, which you should suspect in patients with a high-riding prostate on rectal exam, blood at the urethral meatus, or perineal or scrotal hematoma or ecchymosis. Relative contraindications include patients with the urethral meatus.
Okay, these are the contraindication in which we can't insert the catheterization in a urethral stricture or a urethral trauma. In those patients, we can't do that. We can't insert the catheterization tube. तो हम इसमें क्या करेंगे? Suprapubic catheterization. Suprapubic incision देंगे, then place the catheter. Okay.
Or perineal or scrotal hematoma or ecchymosis. Relative contraindications include patients with acute urinary tract infections and anticoagulated patients. Catheter-associated urinary tract infections, or CAUTIs, are a huge source of nosocomial infection and medical spending, so always think carefully if your patient truly needs an indwelling bladder catheter. I've talked about both indwelling and non-indwelling catheters, so it's probably a good time to talk about that a little more. Indwelling catheters, such as this one, are placed under sterile conditions and have a balloon at the end to ensure that they stay inside the bladder. They're used when the patient will need catheterization for several days. The most common type of indwelling catheter is a Foley catheter like this one. It comes in various sizes, measured using the French system. On the internal end, it has a balloon to ensure that it stays in place. On the external end, it has two branches. One drains the urine into the collection system. It's connected to some tubing and then to usually a bag, while the other is used to fill the balloon with sterile water. We would put it in here like this and blow up the balloon. Be sure to check the number on the ring at the end of the catheter, because that will tell you how much volume to use when filling the balloon. Other forms of indwelling catheters also exist. The Coude catheter is a catheter with a bulbous tip and a curved end, and it's used for patients who have urethral obstructions, such as from benign prostatic hypertrophy. It's placed using a bit of pressure, but the principle of placing it is the same. It has a balloon and it's indwelling. The other type of catheter is a non-indwelling or straight catheter. These are used when the patient only has to be catheterized once. They are still placed under sterile technique, but they don't stay in the body after the bladder is drained. They are not connected to a collection system, but instead drain directly into a basin. Many people self-catheterize at home using a straight catheter. When you determine that your patient needs a bladder catheter, talk to the patient explaining why they need it, what will happen during the placement, and talk about risks, alternatives, and answer any questions that they may have. Inquire about allergies to latex or iodine, as many kits come with parts that contain these chemicals. Ask the patient if they have ever had a previous catheter inserted, and if there was any difficulty with the insertion. Let's briefly talk about the supplies you'll need for placement. Most institutions use commercially available catheter insertion kits that contain all the necessary items you'll need for catheter insertion. In that case, all you'll need to do is look on the outside of the box and choose the appropriate size catheter for your patient. 16 or 18 French is typical in an adult. Let's look at a kit that contains everything you'll need. Sometimes the catheter is packaged separately, as with this kit, so make sure you're choosing the right kit. In addition to the catheter, you'll need cleaning towelettes or soapy water, non-sterile gloves, absorbable pads, sterile gloves, a fenestrated drape, betadine or iodine with applicators for preparing the patient, lubricant, a sterile syringe with water or saline, and a collection system. In this video, we will be focusing on placement of a Foley catheter in a patient with a vulva. Positioning is key for this procedure. Place the patient in a supine position with their knees flexed and soles together in a frog leg position. Place a waterproof or absorbent pad under their buttocks and upper legs. Ensure privacy for the patient. Sanitize your hands and put on non-sterile gloves. Cleanse the vulva and perineum with towelettes or with soap and water. Now that the perineum is washed, it's time to move to the sterile portion of the procedure. Make sure to place the sterile field in an easy-to-reach location that ergonomically works for you. You will be doing most of the work with your dominant hand, so that should be the side closer to the field. Place the sterile sheet under the patient, touching as little of the sterile part as possible. Don your sterile gloves like so, making sure you have nothing below your elbows such as a watch or ring. Open the fenestrated drape and place it over the patient. Pour the iodine over the applicators and squirt the lubricant onto the sterile surface in front of the patient. 2% lidocaine jelly can also be injected directly into the lumen of the urethra with the syringe. Remove any packaging and connect the collection tubing to the catheter. Place the tip of the catheter in the lubricant. Attach the sterile water to the port on the catheter. Though it used to be commonplace to check the balloon, the manufacturer and most institutions no longer recommend this step. You will use your dominant hand to hold and place the catheter. If you're using your left hand to place the catheter, stand on the patient's left side. Spread the labia majora and minora apart with your non-dominant hand, exposing their urethral opening. Your non-dominant hand is now contaminated and cannot assist in placement until the catheter is in place and the balloon is inflated. Cleanse the periurethral mucosa from the top down toward the vagina using one downward sweep of the PrEP solution, then discard. Use the next 2 PrEP sticks to cleanse the left, followed by the right side of the periurethral area. Continue to spread the labia with your unsterile non-dominant hand. Grasp the pre-lubricated catheter and insert the tip into the meatus. When placing bladder catheters in patients with a vulva, advance the lubricated catheter until urine is seen in the tubing, and then advance another 2 to 5 centimeters before instilling saline into the balloon. Once at the correct depth, instill the correct volume of saline into the balloon and gently pull back on the catheter until resistance is met. Re-advance the catheter 2 to 3 centimeters so the balloon is not putting pressure on the bladder neck. Remove the drape from the patient.
Okay, once the urine is noted, then inflate the balloon with this sterile water and then pull back the catheter to the confirmation and feel the resistance. If you feel the resistance, it means the catheter fits around the bladder neck.
Now it's time to secure the catheter. Many kits come with a stabilization device. Usually this device has a mechanism to lock the catheter in a single orientation and adhesive on the other side to secure it to the patient. So, like this. If there's no stabilization device provided, use 2 pieces of tape to secure the tubing to the patient. The first piece of tape goes directly on the patient's leg, under the tubing. The second piece of tape goes over the first, around, and is taped to itself before it's taped down. This provides a mesentery that provides a lot of stability for the tube. Whether using tape or a commercial stabilization device, leave enough slack in the catheter and tubing so there's no tension on the bladder neck. The tubing can then be clipped to the sheets or the patient's gown. The bag should be placed in a dependent position and maybe hung by the string or the hanger above the bag. Let's talk about errors and complications. By far the most common error is a break and sterile technique. Once your non-dominant hand touches the skin, it's contaminated and cannot touch any of the tubing or the catheter. Likewise, your dominant hand must stay sterile and not touch the penis or vulva or outside the sterile field. Another common complication is urethral trauma secondary to insufficient lubrication, leading to pain on insertion. If urine leaks around the catheter, gently tug it to see if the balloon is inflated. If it is, you may need to replace the catheter with a larger French size. If no urine drains, ensure the catheter is fully inserted, deflate and reinflate the balloon when you are sure you're in the bladder, and gently press on the bladder. If you place the catheter and get return of frank blood, it is likely either misplacement of the catheter, traumatic placement, or attempted removal before the balloon is deflated. It can also be from infection, post-urinary tract surgery, stones, trauma to the urethra or pelvis, or cancer in the GU tract. In this case, ensure correct placement, order a CBC and urinalysis, and make sure that an IV is in place, and consider making sure that blood is available. In the setting of trauma to the pelvis, bladder, or urethra, consider a retrograde cystourethrogram. If you're pre-rounding on your patients and find a previously functioning catheter is no longer working, check the catheter placement by pulling back gently until resistance is met. Make sure none of the catheter tubing is kinked, clamped, or dislodged. Seriously, this is the most common cause of loss of function and the easiest to fix. If it's not a problem with the tubing, consider blood clots, urinary sediment, and stones. If the catheter is no longer draining, palpate the abdomen to check for bladder distension. Check with your resident or attending to see if they want you to irrigate the catheter using sterile technique. If all else fails, it may be necessary to replace the catheter. However, check with your resident or attending before doing so. So there you have it, the indications, contraindications, and some troubleshooting of urinary catheters. We talked about the supplies you'll need and how to maintain sterile technique while placing the catheter. Some advice: ask someone if you can open a kit before you have to place one. That way you can familiarize yourself with the kits at your institution and be ready to place a Foley without confusion when the time comes. Ask nurses to let you place a Foley catheter whenever you can. There is only one way to get good at doing it, and that is with practice. Most nurses will be happy to help and will stay with you to make sure you don't run into trouble. Hopefully this video was helpful. Be sure to watch the video on bladder catheterization in patients with a penis as well. Have a good day.
One more thing is that when you remove the catheter, remember that first you deflate the balloon. Deflate the balloon, then remove the catheter. If you don't remove or if you don't deflate the balloon directly, remove the catheter, so क्या हो सकता है, trauma के chances हो सकता है. ठीक है? Okay. Any question regarding this? Please turn on the chat. Any question? Any question? Any question? Please turn on the chat. Admin, please turn on the chat.
The line starts from the 4 centimeter till the full dilatation of cervix. Normal rate of cervical dilatation is taken as
Hello.
जी मैडम
4 centimeter.
Chat on कर दें.
मैडम chat on ही है.
Taken as alert time. And
Any question, students?
findings should be towards the left of this line. If they go beyond the this line towards
No
the right,
question.
then it needs to be alert.
Okay.
But this radiation may
See you
end up
for the next class. Good luck.
line. It is
Lecture end कर
4
दूं?
centimeter.